My project is on Haemophilus influenza. Haemophilus influenza is not to be confused with the virus influenza, which causes the common flu and cold. The bacteria Haemophilus influenza was originally thought to have caused the common flu bug. Later they discovered this bug was actually caused by a virus, so they named the virus influenza, and they did not change the name of the bacteria. So we still call it Haemophilus influenza. Before the vaccine was created for Haemophilus influenza, it was the most common cause of childhood disease in the world. Now with the vaccine in place, it is currently only cause for concern in immunosuppressed individuals. This includes newborn babies, weak elderly, or people on chemotherapy drugs. H. influenza is a gram-negative rod. There is an encapsulated type B strain and a non-encapsulated strain. Most people that were infected with H. influenza bacteria were infected with the encapsulated type B strain. But now that we have a vaccine against this type of strain, people only get infected with the non-encapsulated form, if they get infected at all. H. influenza is a picky eater. In order for us to grow it in lab, it needs to be grown on chocolate agar, which is warm blood. It also needs an X factor and a V factor to grow. H. influenza first gets into your lungs the first thing when you enter the world. In the womb, you're in a sterile environment. When you are born, H. influenza first gets into your lungs. It then colonizes there and uses your lungs as shelter and food. H. influenza is a commensal opportunistic pathogen, which in a way means it is a friend that can turn foe when given the opportunity. Ever since birth, it sits in your lungs, and it can become pathogenic if the immune system is weakened, or if it gets into areas that it is not normally found in. Most disease caused by H. influenza in the world is in unvaccinated children, which are still found in underdeveloped countries. Immunity to this bacteria can arise from vaccines with PRP, from mother to child in the womb, or through natural infection that is won over by your immune system. H. influenza used to cause a large number of deaths before the vaccine was created against the encapsulated type B form. Currently, there is a conjugated form which is available, which is very effective. This is the one that we currently use today. The vaccine that was first developed was not conjugated. It did not have the protein. All it had was a pure form of PRP, which did not work well on children under 5 years of age, and thus children were still suffering from meningitis and other diseases caused by the encapsulated bacteria. After 1987 and the discovery of the conjugated form of the vaccine, these problems have all but completely been eliminated from the equation. In fact, in 2006, only 15 cases of the bacteria-caused diseases were reported in the United States. The encapsulated type B form can and does still exist in children who are not vaccinated because there are these bacteria in small numbers in all newborns. As previously mentioned, when you come out of the sterile womb, you are infected with these bacteria in small numbers. They can become pathogenic when the children are not vaccinated, and this leads to very serious diseases including meningitis, epiglottis, and cellulitis. In fact, in underdeveloped countries today, it is still currently the most significant pathogen that affects children. Clinical diseases and syndromes of H. influenza include the following. Meningitis. Meningitis is an inflammation of the meninges, which surround the brain and spinal cord. This occurs from either encapsulated H. influenza or a variety of other factors, including some viruses. Before the conjugated vaccine was developed, H. influenza was indeed the most common cause of meningitis in children. When a case of meningitis occurs, the individual must be quarantined and separated from anyone until cured, because there is plenty of data showing that it is highly contagious to non-vaccinated individuals. Epiglottis involves cellulitis, which is swelling of certain tissues in the body. It is extremely dangerous because with swelling in the neck, obvious consequences of choking or blockage of airways could result if the condition worsens, and this kind of problem excels rapidly. It is rare in adults since the vaccine and has been practically eliminated in children. Cellulitis, which is characteristic of epiglottis, is swelling in the mouth and throat, basically anywhere where there's mucous membrane in the upper respiratory tract. This too can be very dangerous if the airways close up. Arthritis used to be caused by H. influenzae in children very commonly, before the conjugated vaccine came out. It affects the large joints of the body, including the knees and the elbows. Immunocompromised individuals can still be seen to have arthritis and test positive for H. influenza bacteria. Lower respiratory tract infections, including pneumonia, otitis, which is infections in the eyes, and sinusitis, which is infections in the sinus cavity. Here, it's the opportunistic non-encapsulated strain that can get out of control. This will occur mostly in children without the vaccine, or in elderly who are predisposed to chronic pulmonary diseases, or who have a history of smoking. In these individuals, the pneumonia can result in death in some cases if left untreated. This figure shows where in the body H. influenza can affect and the problems that it can cause. Meningitis occurs in the brain and the spinal cord coverings. Epiglottis and cellulitis can occur in the mucous membranes anywhere in the body, including the throat and nose. Arthritis occurs in the joints. Pneumonia occurs in the lungs. Laboratory diagnosis of H. influenza bacteria can be done in a few different ways. Live culture is easy to do. It is done using chocolate agar, which is warm blood, in order to grow the best kind of results. H. influenza can be seen growing around S. aureus because S. aureus produces waste products that are key factors required for H. influenza to grow. Using microscopy, you can gram stain H. influenza. It should stain red because it's a gram-negative rod. This type of test is very specific and produces good, clean results. Antigen detection is another way you can test for it. It's a fast test, which is advantageous, but it can only detect for the encapsulated type B strand and cannot test for the non-encapsulated strand, which we often need to look for in today's world since we have the vaccine for the encapsulated form. Live specimen is another way to do it. It's a dirty kind of test because sometimes it can be contaminated with other types of bacteria, but it can be done on cerebrospinal fluid if you want it to be done cleanly. This is simply a picture of S. aureus, the white blocks, with H. influenza, the small little dots, growing around it. Because the products that S. aureus produces, H. influenza uses as food. Treatment, prevention, and control includes the conjugated vaccine, which is available only for the encapsulated type B strain. If you want to get this vaccine, it's ideal to get it between 6 months to 6 years of age. You can even get it before 6 months just to be safe. If there is an infection with H. influenza, it can be treated with broad-spectrum cephalosporins. 30% of H. influenza strains are resistant to ampicillin, although ampicillin is still used to treat H. influenza. Also, don't forget to get your booster shots throughout the rest of the person's life. Thank you for watching my presentation. Hope you learned something useful.